yeah, so some of the measures that they take in response to the data, it's, source protection, cleaning, infrastructure remediation, treatment approaches. And for larger costs, the steering committee is responsible for prioritizing what gets done first. In Kenya, it's a bit of a different situation. The model has evolved differently. There isn't a steering committee, but Fundifix is integrating water quality across a range of their services. So from the daily kind of operations and maintenance to their infrastructure installation and rehabilitation work, and then also the monitoring and data sharing with partners in government and elsewhere. The financing and strategic direction is influenced by this trust fund model, which is bringing in finances from results-based funding investors, the government, and then the water users as well. So they have a range of partners from government, university, and NGOs and private sector. So it's quite a different approach, but similar types of responses to the water quality data that this is trying to enable. So just very quickly to give a sense of, how much professional service provision is out there. In 2021, we published this report on a survey of 257 water service providers. Almost all of them reported doing some water quality activity, but it was about 41% that said they were doing the testing, the source protection, the treatment, and reporting, sharing data elsewhere. So, and bearing in mind that this is self-reported, so that's probably a quite optimistic picture of what's actually going on. But some of the key lessons from the work we've been doing in Kenya and Bangladesh on a way forward to integrate a systems-based approach to water safety planning with the service provision models. I think I'm sort of out of time, so I'm going to rush through this really fast, but it's just aggregating information on the hazards has been found to be really useful for risk assessment, for sort of looking over the region of where they're working, using these fit-for-purpose labs, embedding the water safety design and construction at the start of setting up contract, rather than trying to back engineer it, has been helpful from an institutional point of view. And then, of course, the importance of securing financing. So I'll leave it there, but please get in touch with me or Katrina if you have questions after. Thank you, Zach.
I'm happy to ask the first question. I noticed that you and Sital both mentioned fit for purpose labs. And what does that mean? Like, as opposed to what?
Yeah, it's a good question. So it's, I guess the way that we're understanding it to mean is that you're very much setting it up for what you're hoping to use the data for. So it's not collecting data just to follow sort of the rules set out by the guidance by WHO or something like that. It's got more of an operational purpose. So in the case with Fundifix, they started out collecting a wider range of parameters, and then we're able to focus in on what's more useful for what they're able to actually react to. And it's we've transitioned the equipment that they're using, the frequency of the monitoring, and that kind of thing. So it's designing the monitoring for the end purpose. It's not to say that there aren't other labs that are also doing fit for purpose work. Yeah.
I was wondering if you could speak a little more about the Bangladesh model and who pays for those costs. That's something that we struggle with is, we get the data and then everyone's like, well, not it. So how is that working?
I think I might turn that question over to Katrina because she's worked more closely with Safe Planning. Yeah.
Yeah, so in Safe Planning, we set out from the start, as Saskia highlighted, so that the service provider, we had agreed costs that they take, so they do the immediate actions. There's a E. coli detection. So again, this helps the lab being their own, that they get the data straight away. They straight away call the water manager, explain to them, they go and chlorinate, they go and address any sanitary inspection challenge issues, and that's all on their actions. If there's any other actions that's agreed, that goes to the steering committee, and so that's then the government's responsibility, and they decide what are the next actions. So if it's arsenic or manganese, or if it's a chronic issue, then they will be the ones to decide, I think this is where we're prioritizing our investments.
I wanted to thank you for your presentation. I'm curious about kind of your last point about securing finance and the importance of blended finance in economies of scale. And I'm curious if you could say a little bit more about at what point from idea to implementation did it make sense to start thinking about scaling in that state, and at what point did it make sense to start bringing in other sorts of finance?
Yeah, so this for FundiFix particularly, it was kind of always part of the consideration from the very beginning, but water quality wasn't necessarily a part of it. So yeah, I don't feel like there's a clear separation point where it started and then there was a decision that it needs to be scaled now. It was always the idea to to be networking multiple small community systems and sort of user payments, but then recognizing that's never going to be enough to cover the cost. So you have to be bringing in additional funding from elsewhere. And the interesting part with the water quality now being included is that it's opening up more opportunities for some of the results-based funding, because a lot of potential funders, investors are interested in the safe water services side and wanting to have some evidence of that safety. So it's still very much like, this is not a set thing, it's a work in progress. And there's, yeah, but I hope that kind of gets to your question.
Thank you, Saskia.
Okay. So now it is my turn to introduce you to the third model of water safety monitoring. Which is a centralized, more centralized form of water safety monitoring. So in this approach, the idea is to rely on an existing professional laboratory to provide central testing services to dispersed rural water systems. The motivation for this approach is that in Africa, 70% of rural areas lie within 2 hours of a city that either already has a lab, even if it's not entirely equipped yet, or could have one. As an illustration, I'm showing here a map of Ghana, where all the blue and green represent areas that are within 2 hours of a city. So you can see that for these areas that are close enough from a city to bring samples back on time for analysis, centralized testing has at least 2 advantages that I can think of. The first one is that it allows pooling, sharing certain costs between water systems. So capital equipment gets shared, consumables can be purchased in bulk, which is cheaper. And then for sample collection, the cost of fuel to go and collect samples on a circuit can be shared also amongst the many water systems. And then as all of you worked on water safety monitoring, setting up a lab is never enough. You have to train staff, retrain staff, retrain staff, maintain equipment, and then also do quality control. And all of those things are easier to manage when it's for a single laboratory than when it's for dispersed rural testing facilities. So in this model, we would have a lab providing, for example, monthly testing services to dispersed rural water systems. But a professional lab is unlikely to be interested in this arrangement unless there is a financial safeguard. Rural water systems often struggle financially, they have irregular income, and so they may not pay in a timely way. And so Acquia introduced an assurance fund, which is a fund to pay on behalf of the water system. So pay the lab in the event that a water system defaults. So that removes the financial risk for the lab, and the lab is able to continue monthly testing. If that happens, the water systems later in time are expected to repay the assurance fund with a surplus. We'll see later if that really happens. So Acquia has been testing this approach in one district of Ghana since March 2020. So this has covered 9 water systems serving over 50,000 people. Over 2 years, the lab, which was a lab of the urban utility, Ghana Water Company, collected over 200 microbial water quality tests. And what was particularly encouraging is that access to microbial data for those rural water systems kind of triggered a series of really interesting changes. So they realized water was contaminated. They became interested in introducing treatment. They introduced chlorination. Water is now safer. And there is evidence that the consumers are more satisfied. And as of last month, tariffs were actually increased so that the water systems can support both testing and treatment. All of that because they got access to water quality data. And I had a quote here from one of the managers of the water systems where they believe that due to the water quality testing results that they shared with consumers, they gained new contracts, in particular, a new contract with the nursing college. So they think they gained customers thanks to those water safety measures. Through this experience, we learned that the assurance fund was really necessary to keep the monthly testing going. So to put some numbers and to put things in perspective. So over the 2 years, water systems defaulted 11% of the time. So 11% of the time, the assurance fund paid on their behalf. Of those, we've been reimbursed only a third of the time. So we're still trying to recover those payments. And there is another instance where the assurance fund helps. So water is intermittent. And so sometimes when the lab shows up, there isn't the water to be sampled. They still want to be paid because they travel there, but the water system doesn't want to pay because they didn't get any results. So that's where the assurance fund can pay for the transport at least and avoid any tensions. So it is a drawdown fund, like the assurance fund will get depleted. It is absolutely a way to subsidize testing, but in our experience, it has been one of the most cost-effective ways to do it in those areas, at least that are within 2 hours of a city. So the assurance fund was initially launched with support from the Hilton Foundation, but we now have funding from USAID through the Real Water Program to expand it and evaluate it formally across a larger number of locations. So we're planning to scale up this the approach in Ghana, Kenya, Uganda, and Tanzania, and we're currently negotiating agreements with laboratories in 3 of those countries to reproduce this model. Yeah, that concludes my presentation. Katrina, I saw your card.
I just wanted to know how long it takes the data to get back from the central labs back to the water microbial.
Yeah, so that's so a month in theory, like we a maximum a month, because when possible, we ask the lab to send the results via WhatsApp to the water system managers, but not all of them have WhatsApp. So worst case, they get the results on paper the following months. But that's where, to make sure that this process really happens, you know, the assurance fund and the Acquia team behind really it was instrumental, like because we're following up every month to make sure that the results were shared. So it's not, you know, I presented it as a financial tool, but it's more than that. It's also like ongoing support and just monitoring that everything is happening as it should. Yeah.
I think I saw somewhere along the model, you indicated there will be enforcement from the local authority.
Right.
But I want to have an understanding of how that enforcement is proposed or was implemented.
Right. So on paper, there is an agreement between the assurance fund and the local authorities, in this case, the district assembly, in which the district assembly committed to force the water systems to repay. In practice, it's not happened. As you can see, we'll only be repaid a third of the time. This is partly because we're still recovering from COVID, where these water systems collected no revenue for over a year, because in Ghana, there was a free water mandate. But it also just illustrates the difficulty of actually enforcing. So I think we have this clause, and it's, you know, in theory on paper, they're supposed to enforce, but we're we're realistic that it's not going to be always enforced.
The reason why I asked that, because from the understanding of the sector, you realize that the assembly, the local authority, they themselves are supposed to even to support the water system.
Right.
And in fact, in principle, the assets.
Yeah,
we say they own
it,
an assembly owns it. So sometimes it becomes difficult if the so probably you just need to, because the responsibility when the system default it comes back to the assembly to rather pay.
Right. Yeah.
So that is what it actually means. So for them to push the system managers or the system operators will rather come to the assembly, please, the facilities are yours. In fact, you have to pay.
Right.
Then there will be also conflict of
Yeah.
interest, because the authority at the same time is supposed to be a service provider and at the same time a regulator. So it's a bit.
Right. I think a key part for limiting tensions is to initially enroll water systems that can afford testing. So now in our scale up, we're screening water systems whose monthly surplus exceed the cost of testing. We want to make sure we initially only enroll water systems whose revenue is sufficient to pay for it. Otherwise, we'll run into issues like that a lot. Right. Yes, please.
Yes, if I understood correctly, the information is primarily provided through the provider.
Yeah.
I wonder if you consider sort of publicizing it more widely, almost like a restaurant sanitation base.
You mean for publicizing it to the consumers, or? Yeah, this is also something we're still working on. So we have found that there's been insufficient communication to consumers. The managers say that they post the results like in writing at the kiosk, but people can't really read. So it has been inefficient. So yeah, we're considering now to publicize the results through the radio, the local radio, so that people hear the results verbally, because in writing hasn't been successful. Yeah. Esther?
What type of contract have you set up with the labs? Because one of the challenges we've seen before is like service delivery models and how we ensure that the contracting prioritizes what we're looking for over other work and things like this. So I'm curious to know if you have a standard contract that you're using, and then if that's shareable and replicable maybe for others to look at.
Yeah, absolutely. Yeah, we have now a contract that we're actually replicating and copy pasting for other countries. But I also want to be transparent that making sure the contract, is really enforced with the lab requires a lot of follow-up. So in practice, we have like an assurance fund staff who calls the lab to make sure, are you going this month? Are you sure? So there is an amount of like a certain amount of follow-up for sure. Thank you for your questions. We're going to now transition to the fourth type of water safety monitoring, and I'm going to hand it over to Ahmed Ahmed from the JMP. Thank you.
Thank you, Caroline. And yes, I'm working for the JMP, and JMP is led by WHO and UNICEF, and I'm from the UNICEF side. And I'm here with Christy Chatley, also another JMP member, team member. So just to set the scene very quickly, JMP is responsible for monitoring and reporting of the global SDG indicators, including SDG 6.1.1, which is the proportion of population having access to safely managed drinking water. Information for this indicator is actually coming from various sources. And for one of the important components of this indicator is the water quality. So definitely the household surveys is one of the key sources for us because it enables us to link this information with the other inequalities for the SDG for the global monitoring purposes. Multiple indicator cluster surveys led by the UNICEF team again is one of the main sources we use. And since 2012, there has been a lot of work going on, and we developed a water quality questionnaire which is plugged in the household surveys. And so far, over 40 countries collected this type of data with technical and financial support from the JMP team. For the evaluation of preform contamination, we actually consider fecal contamination as the top priority for all countries. And E. coli testing is embedded in this mixed surveys. It is also possible to assess high priority chemicals through mix, and fluoride and arsenic are the two main components where it is relevant. And we follow the WHO guideline for the drinking water quality. For mixed water quality testing model, I should inform you that there are two samples we take from the drinking water, from the glass provided by the household, and from the source coming to that glass, basically, drinking water. And as I mentioned, we identified E. coli, and the test takes around 5 to 10 minutes, followed by 24 hours of incubation. The good part of this maybe is the subsample, because we use basically the main household survey sample and extract a subsample out of it, which helps us. It is easier, which is representative, and it is approximately 3 to 5 households per cluster selected. Another advantage could be using the existing team members. In the mixed surveys, we have this anthropometry measures already embedded in the field team. So most of the time, they are the ones collecting this data. For quality assurance and quality control, there are lab technicians involved in these trainings, and also in the beginning of the data collection, they are in the field helping the team to run the test properly. There are blank tests to see contamination, relevant issues, and as usual in households, field supervision is there. For the water testing equipment, we use adaptive membrane filtration approach in most of the cases, in most of the surveys. And UNICEF Supply Division supports the countries for the procurement of these tools. I mean, there are many items here. I won't go one by one. But one important thing to mention is maybe the body belt incubators we use, also when applicable and possible optional electric incubators are used. I have already mentioned some of the advantages, and I see that there are so many now. So I'll just move ahead with the key challenges. One thing to mention is time to get the results. As I mentioned, it's minimum 24 hours to get those results. And for the trainings, I can tell there's an additional burden in the field at the end, and it's an additional of 3 to 4 days of training. And on top, there is this piloting, field testing. They need to exercise. Cost, equipment and consumables can be considered maybe separately. For the equipment per team, it is around $1,500 currently. And for the consumables, it is $2.5 US per test. For the incubation, there could be problems because some people, if they're using the incubator, they don't want to wear it at night, for instance. That could be a problem. For the electric one, electricity is a problem. There are things to improve there. Disposals, we should be environmental friendly. There are so many plastics around, so they should be disposed properly as well. And planning-wise, that is important, that the procurement process should be done in a timely way. This is one of the main problems we face. The planning should be done in advance so that the required items can arrive in the country on time, the trainings can be given on time. And frequency could be considered as well, because household surveys is repeated every 3 to 5 years, not so frequent. And there are more. But I should mention that there are many studies going on to improve the situation with UNICEF Supply Division, and Esther will present a little bit of that in the following minutes, actually, on the rapid tests. WHO just analyzed the available tests in the market, and they just published a report on portable kits. I'm sharing the links here, but I know you cannot read them. So how we present the data is this is just one quick example. It's from Chart Mix survey. Just to show you that if we can have the segregated data, here you see at the last column, people from contamination within submission regions where charts stand, if we can compare the result in various levels. It's just a quick example. And I think I will finish. These are the resources that I can give you and many more. If you can contact us, through info.wash.org, or if you can visit our webpage, washdata.org. Thank you so much.
Thank you, Anta. We have time for questions.
I have one which you prompted me to ask actually of the other presenters, because you're actually the one who mentioned quality assurance and quality control. I wonder if each of the presenters could mention just briefly the QA/QC procedures in their different setups.
Oh, sure. Yeah, so ours is quite informal. I guess you could call it fit for purpose also. It just involves what we call repetition training. And it's a matter of convenience that when one of our staff members is going, because we repeat these methods across all of our projects, our staff are really familiar with it. They often arrive and just make a plan to visit each lab, check on the procedures. That said, we've been doing it long enough that I think the knowledge is really in-house now. And Val Mukunda, who is our main collaborating engineer, performs the quality assurance checks himself and does it that way. There's no like formal reporting or processes, and maybe we can improve that area.
We'll go next. So with the HISAWA and 4DFix labs, they use sort of a set percentage of samples with duplicates, replicates, and blanks for the microbial work. And then for the probes, it's just doing weekly calibration checks. Yeah, similar for the assurance fund, for the agreement we have with the lab, they conduct blanks, positive controls and negative controls. And we have worked with the lab to embed the cost of these in the cost per test, which they were not initially doing. So we're making sure that it's the normal cost plus 20% to cover for this QA/QC.
I should also add, it's exactly the same for us, and like that, the tests are covered already.
Yeah. Looking at the cost of your equipment or the complete set, which is about $1,500. I was wondering if how it will play out if I acquire the team. Probably should start maybe working with this GMP, test kit. Will it play out? I know, even though it looks like just the microbial, the E. coli, probably the fluoride and that of the arsenic. But will it be probably applicable, or will it be useful, or will it be cost effective? Or how will it play out in terms of acquire your model? Is not probably rely on the 2 hour away, maybe central labs.
My sense is that the lab could very well use the compact dry plates that you are using. They would still bring them back to the lab for incubation. So they're doing membrane filtration right now with another technology, but if they switch to this, they would just use the same setup. I don't think they would use the belts. Yeah.
And maybe it's
I was going to something. So the mixed manifold has been specifically designed for the mixed team, and so that incubation belt is something that is procured through supply division alone, and it's not something that I know of anybody else choosing to use. Having slept in it, I can completely understand why. I've also done Pilates in it if anyone's interested. Anyway, my point is that if you're using the lab, the whole point of the lab is you can have more more technological approaches. You don't have to have as manual a process because you can have more fixed infrastructure. The challenge we see with, and we've looked at contracts that would actually allow us to pay to have the lab, and the cost per test includes the hardware. So we've done this with vaccines, for example, and testing in other areas. And I think the challenge is here inverted contracting, which is why I asked Caroline about the contracting before. Doing something differently takes time and change, and the mix want quick results that they can then process. They're churning out reports every 6 months, and owning the results process allows them to manage that process. If we start then using labs, then we've got different timelines that we're playing by. So I think first of all, the labs need to demonstrate they can do the contracts for Caroline before we can then look at the mix doing it. And hopefully that's what we're going to see through Caroline's work. I hope that helps, and sorry to have jumped in.
No, that's perfect. Exactly. I mean, it depends on the definition of the question, but I just want to add also, this is kind of an initial investment, right? I mean, when they buy, the country owns that equipment, actually they can use it again as well. We should also remember that. I think the equipment stays if they wanna, most of the time actually UNICEF country office keeps them and it is used again. So it's not always we spend that specific amount of money. It's also one thing I want to mention.
I think we need to transition. So we're at time. Thank you, Aita. Thank you very much. So thank you for your attention. We are now going to transition to an activity that my colleague Karen will introduce. I'm trying to get them.
Actually, we can go ahead and explain the instructions. We're going to give you all a minute to stretch here. So I know you've been sitting for a while. We'll call this side over here, these two tables, group 1 in the back, group 2 over here, group 3, and then folks in the middle, group 4. So that's just going to follow the order of the presentation. And we'll try to have somebody from those presentations join your group. So you're welcome to get up and stretch. And I know these tables are a little bit awkward to work around, but see if you can kind of come together in a group as well as you can. We'll have about 8 minutes. We're going to do just a matching exercise. So we're giving you some hypothetical areas, and we're giving you 4 monitoring models. And we want to try and figure out if we can match a particular monitoring model to the location. So group 1, you're fully decentralized or on-site monitoring. Group 2, in the back, you all are the partially decentralized lab. Group 3 is off-site centralized monitoring, like Caroline spoke about, and then group 4 is going to be national surveillance. So at the end, we'll come back together. We'll ask somebody to pitch which of the locations that they think the monitoring model would work in. So with that, go ahead and feel free to get up and stretch a little bit, and we will get into groups.
Okay.
Set up your last not feeling very productive, not very long.
What we have, and that is where I also that's not
They're like great.
but then what makes national will be the public.
But yeah, getting certified is
Now
that's been very long.
Yeah, I think that was interesting. The point, I think our original thought was national. But it's great, they're like other versions of it. That might consider public health, like, other songs? Yeah.
Because for me, national so that is my understanding.
And that's not clear in any of them. There's a national regulator.
But for me, the aim was a bit
Back to the activity. What do you
But it depends, the model and other styles all kinds of yeah.
others.
About 2 more minutes, everybody.
Like we have national stability. What do we do? Where national stability? And then B.
I can barely
Which okay, it's national stability. What is probably is it where national stability will be required? Or
I say optimistic.
In 2019, summer 2019. How hard it is.
All right, we're gonna reconvene everyone to hear your answers. If you don't mind heading back to your seat and we'll get started. Or stay standing if you want. Right, if y'all don't mind quieting down, we're gonna go ahead and get started. All right, so we're gonna start over on this side of the room. I know they're ready. So this is monitoring model 3, centralized offsite monitoring, and they're gonna go ahead and pitch which location they would like to invest in.
All right, so we were fortunate to be able to consult with Caroline, so we would have got there, but so we settled on A. Of the 4 that fit the criteria. The only caveat was that would assume we'd have enough teams to get out there, all the sites within a few hours, finish sample collection within a few hours, and get back to the lab within a few hours or so. But it would meet the criteria because you have a certified lab sufficiently close by. And that's also something that the utilities would want. Yeah.
All right, thank you. We'll reveal the answers at the end. So if you want, you can counter argument and try to take A. All right, so let's go ahead over here to monitoring model 1. This is fully decentralized or on-site monitoring. You will have a response ready.
So yeah, so we decided on the and it's ideal for what we're doing right now in the rural settings in the mountainous regions. So having labs, certified labs or even uncertified labs around is difficult. And then we're also looking at the water schemes from the spring source as well. So it's like ideal for us.
Okay, very interesting. So we have one group going for A, one group going for B so far. How about in the back? What did you all come up with?
for model 2, the partially decentralized world.
Yes.
Firstly, it was a nice question because it wasn't a no-brainer for us. We had to kind of talk about it a bit. And where we landed was Mojada, because one of the things we were trying to net out was the distinguishing features between the models, and one distinguishing feature of this model too is that it required professional service providers who could do the testing. And so on the basis of the infrastructure they have with filtered water, chlorinator, and pipes, that will hopefully that's on staff on board to support that. So C.
Okay. All right, so we have an A, B, and C. And how about group 4 in the middle, the national surveillance?
Well, I'm sorry, group 1, we also would like to. But I do think that we can work together. As we go through, the different options for us, what we didn't see with B was the skill sets necessary to actually conduct the testing or the finances necessary for it. And so without those two pieces, it made most sense for us to have the national surveillance periodically. But this is where we really can work together, can get that decentralized system set up. That's still not going to be monitored as closely, probably, as much as these centralized labs might be. So we're able to come in and check every 5 years just about things are working.
All right, great. Thank you all for trying that out. I know it's tricky, and these are theoretical, hypothetical cases, so there is not necessarily one correct answer. You have to make a lot of assumptions, but we can go ahead and reveal. So group 1, we actually were thinking about D, Maji, the one that was not taken. So those are the larger pipe systems, some bigger rural towns, sort of close to an urban center, where maybe there could be more centralized monitoring, or sorry, decentralized on-site. For group 2 in the back, you got it right. Mojado is what we were thinking. So well done there. And then also the group over here, model 3, we were thinking A, and I believe that's what you all went with. Yeah. So great job. If I was handing out funding, you would all get funding. And then in the middle here, we were thinking B, because these are kind of far away. It's not formalized monitoring. And so there might need to be some national surveillance that covers those types of areas. So yeah, great job, everybody. And then we're going to do a little demo here of one way that you might use some data to actually be able to solve these kinds of questions.
Right, so bear with me, I have to project a very simple Excel tool that we made. You may stretch your legs while I'm putting this up. Okay. So first of all, I apologize. I'm projecting an Excel sheet. I know it's very rudimentary, but the positive side is that I'm happy to share that Excel sheet with anyone who's interested. This is how I like to think about comparing these different models. So centralized versus on-site or decentralized. And I like to think of them in terms of finances or from a cost perspective. So here you're looking at a very simple model or simulation, and you're looking at different types of costs. So you've got consumables, you've got equipment, you've got labor, both for taking the samples, collecting the samples, and then analyzing them, and then transport. So for example, transport only shows up in the centralized model, because if you're testing on site, there's no transport. It's you're collecting it on site. So on the left here, those are a bunch of parameters that you might want to play with for your respective settings. So sorry if it's not very large, but let me list a few. Number of water systems. So you might be in a district where there are 50 water systems. They, as per regulatory requirements, they have to collect 2 water samples per month. A very important one is how closely packed are they? So right now I have put a distance an average distance between them of 15 kilometers. So if they're, closely packed like this, you can see that centralized testing is more cost effective. It is cheaper to go out and in a circuit, collect water samples from all of these systems, go back to town. But if I change this, for example, now if they're not closely packed and it's 50 kilometers, very different. Decentralized testing changes a lot. So that's one big take home is the density of these water systems, how far they are from one another and from the lab is the main impact factor for deciding which one's most cost effective. I've also played with fuel price, driving speed, the wages of staff. All of that matters, but it's not as impactful as this. So the big takeaway is that it's really distance, not only between the water systems and the lab, but between water systems themselves. So this is how we've been thinking about this at Acquia and with the Real Water program is really thinking about the cost effectiveness, and it really comes down to density. Happy to share that with anyone who's interested. Of course, you can improve it. It's very basic right now for the sake of this demo, but this is one way to think about it. I don't know if there are questions, probably not. Very simple.
Actually,
yeah.
I'm curious that you have here this model, we have no labor costs for decentralized. Presumably someone is still doing the test.
Correct.
So maybe you can explain that a little bit more.
Right. I made the assumption that in this model, it's no additional cost because the water system probably already has full-time staff, either volunteer or paid, but this would just add to their daily duties. So they would, do that within their existing wage. But this is a first approximation. I just want to add one thing, that the reason we developed this is because on-site testing is very popular and there's a lot of technology development around, okay, how can we do tests on site? And the reality is that you really run into this blue bar, the equipment. No matter, it's really hard to get the capital cost of a testing kit much under $500 or it's often $1,000. So the reality of on-site testing is that we have to make sure that this is really the most cost-effective way. Equipping 50 water systems with their own equipment, it's expensive. And so in many cases, centralizing at least partially is more cost-effective. Yeah.
Why do you put one system that rather than they use them?
You mean here, annual cost per water system? Interesting. I guess that's the unit that I think in terms of that's how much they have to pay, and I'm interested if they can afford it, but do you think the comparison might be different for a user?
Yeah, they're very different levels of systems. I mean, it gets very complex, right? With the number of samples needed for all the rest of it. But
correct.
A different way to look at it and very easy way to communicate it to, how many, how much per person to make it.
Right. Yeah, that's a great comment. Thanks. Pascal?
Just a comment as well. I find it really helpful to think about this tool as sort of the edges of the spectrum.
Yeah.
So it's not, black and white or one or the other, but something in between. To Rachel's point, Fundifix and Haisawa would very much say that the additional time on staff costs and transport is substantial above what they're doing for regular maintenance without water quality. So between the pillars.
Yeah, and it's very rudimentary. It can definitely be improved, but I guess just to encourage people to think of it in terms of costs as well, and not just I feel that sometimes this element is not part of the conversation. So that's mainly why we developed it. Thank you. Gosh, I'm really struggling with this. And okay, now we're ready to go ahead with the last section, where we're going to have Esther Schiller from UNICEF Innovations and Karen Setti from Acquia present on the latest technology development.
And if we're going to do another group exercise if we have time. So if you can get out your mobile devices or computers, we're just going to talk for a minute and then we'll do one more activity.
Okay, so I apologize in advance for these slides. I've got a lot on 2 slides, so I'm really sorry, they're not my greatest work. But as you've already heard, UNICEF at Supply Division does a lot of procurement on water quality testing. I sit in Supply Division, but I'm not a procurement specialist. I'm still a washie. My role is on product innovation. We've talked about a lot of products, but we've also talked about the flaws with them. I actually already said that we're waiting 24 hours for results. Caroline's been talking about how long it takes to get results via the lab. One of the reasons we look for on-site testing as a solution is because we like the idea of being able to control when we get the results and then act on it or do something with it. So over in product innovation, we've kind of been thinking about, how far can we push this? So, oh, it's moved. No, go back. We're not ready for the cat yet. Cat's coming. What our project is looking at is whether or not we can rapidly identify, and I'm very careful here, fecal contamination in drinking water. We've talked about E. coli. Katrina can tell you the issues with E. coli. She has educated me well. Thank you. E. coli is a chosen indicator by WHO. We can discuss that separately. We're looking at fecal contamination, i.e. what is the risk to the individual if they drink this water that they are going to get sick? That's what we really want to know with E. coli. So what we're looking for is results in 6 hours or less. Actually, my question to all of you is, how fast do you want your result? And I mean, let's not get crazy here, right? My dream is a pregnancy style test that tells me whether or not this drinking water is safe. But if we have that quicker result, what are we then expecting communities to do with it? Because there's no point having this data if we don't expect a result. So it's a bit of a dangerous one. We're looking for something that's easy to use. We've talked about this training element, the cost, the time, the additional factor for making sure it happens. How easy can we make this? The pregnancy style test is like the epitome. Cost, we've already had the cost of $2.5 for the mix. That's about as cheap as we found it. H2S is cheaper, and you can talk to the Aquagenics team about their test, which was recently evaluated by WHO, and it's pretty damn good, but it's only a presence absence. I'm talking fully quantified. And how easy is it to transport? The bigger the equipment, the longer it takes. One of the things with taking results back to the lab is how long have you traveled to get there? Will your sample start to break down before you actually get it to the lab? If it then sits in the lab, if you get there at the end of the day, is there a lab technician actually going to process it, or is it going to sit there for another 12 hours? That's one of the reasons we look for on-site. And this beautiful graph here, coming back to Caroline's point on cost, is how we see the market. This is the market for portable E. coli testing. The bottom 2 parts are North America and Europe. So that's your bottled water market, basically. But the blue stuff in UNICEF blue is the market as we see it. There's actually an attractive argument to industry and the private sector to be looking at portable E. coli testing kits, because there is actually a market. When you add all of that up together, it's a significant part of the market. And UNICEF Supply Division sees themselves as kind of the access point for this. So what we're looking at is how do we generate demand to ensure that that market piece is there? What are the new technologies? And there are some big words in there. Ask Katrina to translate. I'm not getting involved. I can do it just now. How do we validate this? How do we prove that a product does what it says it does? And how do we get the confidence from government partners, from different utilities, that they want to use this test if it doesn't measure E. coli, because WHO are using E. coli as an indicator. Now, I'm not saying it's a wrong indicator, but we do need to look at, actually, we might get quicker if we don't look at E. coli. And then lastly, yeah, the considerations for decision makers. This is Professor Cat. Professor Cat is non-gendered, by the way, because we don't gender them. And the big question is, how quick do they actually need to be? Does it need to be a pregnancy style test in 2 minutes, or is 2 hours actually enough? Because by the time you've gone all the way to the community, you're probably doing other things while you're there. How quick can they be? That's another question altogether. And how much are you willing to pay for that? But the biggest factor is, what's the ease of use? You've got your utility trained staff who can do measurements and use the membrane filtration kits. And then you've got your community level users where your H2S and your Aquagenics comes in. How easy can we make this, and how effective can it be? And what are we willing to pay for that? Because that's the reality of the cost per test. What are you willing to pay for a result that you can have within 2 hours? And what are you going to do with that result? And that's what I'm trying to quantify right now. And that's where Caroline's work for me is particularly useful, because she's actually got some answers for me, which are developed than I thought, which is great. But yeah, so this is our project that we're working on. If you want to know any more about it, I'm doing a poster on Wednesday. I'm around all week. I'd love to talk to anyone and everyone about this. If you've got any products, ideas, let me know. Thank you. That was more than 2 minutes. I'm sorry. Thank you. Have I got time for questions or?
Yeah, there's a burning question. Okay. Great. Okay. So, yeah, I think that was one way of thinking about tech. And Esther and I had this conversation last night that the way they're thinking about tech is different from maybe the way Acquia, who does a lot of applied research, is thinking about tech. So we actually, under Real Water, were able to put out one innovation report on tech innovations and one on financial innovations. So we're really thinking about this as, is it a new idea, a new concept, a new model? Is it something that's being applied differently or applied in a new space where it hasn't previously been applied? So we know that a lot of things are working well for, you know, large, well-funded urban utilities, but then when you're trying to move that kind of concept to a rural system, there's a lot of adaptations and innovations that take place just in that process of making sure that it works in rural settings and it can serve rural populations. So in the report, I left a few QR codes up here if anybody's interested in scanning those to get to the report. But we talked about 9 different modules. We have some on decentralized water quality testing. What are the technologies for bringing water quality testing to rural areas? We talk about solar pumping, membrane treatment systems that are used, especially in places with really challenging water quality issues. We talk about digital payments and how that ensures better cost recovery. Smart metering to make sure that you're not losing non-revenue water, that you're adapting to kind of climate issues that are coming up. Also remote sensing devices, the Internet of Things, the big picture of kind of devices, how they're connected to different software programs, how that information gets back to a manager, and how they can then go back and correct or manipulate or understand what might be going wrong in the system. And then we also have some things on kind of on-site chlorination. So you think chlorination would be happening everywhere by now. It's been around for a long time, but it's not. And so there are some kind of intractable issues there. There are different technologies that are maybe starting to deal with that kind of thing, but haven't been tested widely in rural communities. So I encourage you to check that out if you get a chance. It's another way of thinking about innovations. But we also want to hear from all of you in the room because we know you have lots of experience and, you know, brains that are working hard at innovating in this area on a daily basis. So if you are able to grab a mobile device or computer and go to slido.com and then punch in this code 1064743, we will share what you all are working on. Does anybody need more time with the number? You know, I'm very slow with tech, so.
Maybe, Karen, can you define that a little bit more, like monitoring models?
Yeah, so it could be any aspect. It could be the tech, it could be the nature of the application, could be the way that it's financed, the way that you're training people. So,
but specifically for water testing.
Yeah, any aspect. Yeah, it's innovative.
We have 7 results.
Okay. Yeah, I think they're not showing up on the slide.
There are 10. Oh.
There's the technical working.
Do you want to just project it?
Maybe I can just go to the website. I can't. Valerie, can you remember the number? 107? And then yeah. Oh. Okay. All right. Well, thank you all for your submissions. We're having some trouble with the Slido connector and the Zoom and the PowerPoint all running together. So we'll wrap up with closing remarks, but thank you for your submissions. We'll definitely be taking a look at those after. I appreciate your input.
Thanks very much. So I'm Professor Katrina Charles, I've already mentioned her a few times. And yes, do come and talk to me about E. coli if you'd like to have a chat. So thanks so much for joining us today. I think everyone here is aware that we've got 2 billion people around the world who still lack access to safe and managed drinking water. And that it's the water quality that's the biggest barrier to that. So this is such an important topic, and it's been really great to have this discussion today. I think we've focused today on E. coli as one of the priority concerns, but there's a lot more work to be done in making sure that we're addressing not just arsenic and fluoride, but addressing emerging risks around salinity, around pesticides, around so many other contaminants that I imagine lots of you are working with already. We do too often assume water is safe, and for rural communities, particularly the ones that get left behind, because of those topics that are being raised today, that they're seen as too expensive, too far, too hard to reach. But what I really hope is that these different models being presented today give you some ideas about actually, no, it's not that big a barrier. There are different models to try this now. There's so much innovation in the way that the tools we're using and the way we're setting up institutions to manage these that can make this affordable and make this work for people. And so if you're looking, you know, when you do report it in terms of the cost per person, it's not that expensive. And that's something that will be discussed in other sessions throughout the week. I mean, thank you so much for engaging in the discussions with us today. It's been really interesting to hear about your work. And if you did enter information on that poll, I'm sure the teams would like to talk to you more. So do come up to us and chat further. We're looking forward to many more conversations on this topic across the week. So I'm going to mention a few other sessions, because one of the big things we haven't really discussed today is data for decision making, of how we take this data forward and have action as well. So that's going to be a key topic tomorrow in the small water systems session, which is on at 8:30 in Redbud. And so Rachel and Sarah and I are all presenting further on these programs there as well. So we've got more discussion of safely managed drinking water measurement and metrics this afternoon at 1:30 in Windflower. And there's more discussion of chlorination. So what do you do when you get that positive result, and looking at the treatment options on Friday as well. So we really enjoyed this. I really enjoyed this discussion today, and hearing from these other teams, and looking forward to building the collaboration more to really try to advance water quality monitoring to make sure that we can get safe drinking water for all. So thanks very much. Enjoy the rest of the conference, and we look forward to talking with you more.
All right. I think about
Love that.
Oh, I don't think that's light up.
How well the process.
It's not like okay, best case scenario. You might use
Yeah. Yeah. Yes, I got
I'm getting and then we probably really each day.
Yeah, I think it's got I was hoping yeah, I guess I don't
Oh, but I mean, I haven't been by myself. Okay,
I was gonna try to coordinate.
okay, so just for that.
Thank you. Yeah, I know it's like super.
I got to hear from okay, yeah. Yes.
Yeah, my husband's been to diet, so he put it from there.
Okay.
So you're saying maybe I would use like a private person to set up.
Yeah. I don't have to do that. You just have to have like I'm ready. You can develop it on your own. Okay. But it was like that person that you yeah. No, she left her.
Okay, so she's able to. Oh, nice. So we're yeah, right here.
I was very excited pretty much every time I saw it. The paper we have to contract. For us, part of it was starting to work in the space just to kind of our sense was not much in that. And this kind of confirmed, like, yeah, there's a Not the beginning, I would think about that, like obligators, you don't understand, don't have what people do. Very well. 170, we're historic, and told them actually. So kind of, at least there's a lot of like dedicating about water and all that. That would be fine. Yeah, it was very nice to meet you.
I have the same brain.
Main regions that involve this.
National level. Makes sense. Everyone's